So why do kids need to get adjusted? Why do kids need chiropractic care? Just so you know, I have two lovely children. I've got a 14-year-old girl and I've got a new son, a new baby son, and they both have been adjusted since birth, and they will continue to be adjusted, hopefully, as long as they live, as long as they want to live a happy, healthy, and full functioning life. But why do kids need to get adjusted? Because most kids don't have neck pain or back pain or a lot of the traditional things that you think chiropractic is for. And quite honestly, that's what I thought chiropractic was about before I got into the profession. So stiff necks, sore backs, and babies don't have any of those things. So the question is, why do kids need to be adjusted? And if you look at statistics from OSHA, the Occupational Safety and Health Administration, the average kid, by the time they start kindergarten, they've had about 2,000 spinal traumas. That's from slips and falls, learning to walk, riding a tricycle, falling down the stairs and off the changing table, and even the birth process itself. The birth process itself, most people don't realize, is actually very traumatic to a baby. So we're designed to deliver, or women are designed to deliver babies in kind of a squatting position. It uses gravity. It allows you to open the pelvis fully. But in America, we tend to do it laying on our back. So the OB tends to have to pull the baby out of the birth canal, and they use the head to pull the shoulders out of the birth canal, which can be very damaging and traumatic to the neck. So for that reason alone, babies need to get checked and get adjusted because their spines can be shifted out of its normal position. And that happens not only from birth, but again, slips and falls, injuries, falls, contact sports, trauma. If you watch a baby learn to walk, if you've ever watched a child learn how to walk, they slip and fall and do the diaper drop onto their butt literally 50 to 100 times every single day, which is traumatic. So the average kid has about 2,000 spinal traumas before they enter kindergarten. But the good thing about kids is they're very resilient. They're very adaptive. They compensate very well. So they don't tend to have a lot of aches and pains that most adults do. And if you watch a kid, like I used to watch my daughter, she'd run down the stairs and dive into the couch head first. And if I did that, I would be out of work for a week. But she gets up and goes and plays and just lives her life like nothing ever happened. So kids adapt, but that's not always a good thing because it means the problems that they have tend to go unnoticed, and it tends to surface later in life. So you get the kid that has, a little bit of scoliosis when they're younger, and then later on they develop chronic lower back pain. Or the kid that has ear infections because the nerves in the top of the neck control the eyes, ears, nose, and throat. So if those nerves get damaged or they get interfered with, it can affect the way that the ears function and the eustachian tubes and the sinuses and things that we would never associate with chiropractic care. So the common warning signs we see in kids: early on as babies, we see a lot of kids that are subluxated, which means their spine is out of alignment and the nerves are irritated or damaged. So that condition presents as colic or reflux or chronic ear infections as they start to get a little bit older, sinus and allergy problems, or just the kid that tends to get sick every time the weather changes or multiple times per year, asthma. So those are all common conditions that are associated with a body that's unable to function properly and adapt to the environment, because the body's designed to heal. If the body's not adapting to the pollen or to the change in temperature or to the cold and flu season, then that generally means that the body is not functioning at some level. So get our kids checked. Again, I know they don't have symptoms or they may have minimal symptoms, but it's important. If we want our kids to be healthy, we got to make sure their bodies function at 100%. So that's the message. God bless.